Good morning. This is a special meeting of the Berrien County Board of Health in response to an increase in COVID cases in the county. And the objective is to figure out what we need to do as people in the county to kind of tap on the brakes of this COVID. So I'll turn it over to you, Nikki, and I wanted to thank you and the staff for doing this special meeting. So thank you.
Yes, of course. All right. I'm going to see if I can actually do this as a slideshow. Are you still seeing my screen? With the slides and everything? Okay. So I'm showing you the epi curve. We've kind of got some familiar slides in here. So this is the graph that we have been looking at most of our meetings. We spent a lot of time, we spent several weeks kind of in this plateau here. And at the beginning of October, we deviated from that several week trend and started to increase in the number of confirmed cases, because this is the graph showing the number of confirmed cases throughout the course of the pandemic among Berrien County residents. At this point, we're averaging a 7-day rolling average of just over 40 cases per day. To put that in perspective, we didn't break 20 until October. So things have definitely increased rather rapidly. We do know that in this last month or so, the amount of testing that has been performed in Berrien County has increased somewhat, which is good that the capacity continues to increase to meet the demand. And really, it wasn't even necessarily capacity increased, but that we were filling up more of our capacity for testing. But the increase in testing does not explain this exclusively. Then when we look at percent positivity, that is again something that for several weeks was really humming along. We were hovering right around 3 to 4%, which is what a lot of experts say. If you're around 3%, you can feel fairly confident that you're capturing, that you're identifying all of the cases. So as you would expect, with the number of confirmed cases going up dramatically, we have also seen a fairly significant increase in the percent positivity. But to give this number some context, we know that many of our residents, Berrien County residents, they are seeking testing in the state of Indiana. A lot of that testing is rapid, and we are having more providers in Berrien County that are starting to offer a rapid antigen test. Not a ton right now, but it is growing. With those rapid antigen tests, we do not generally get reports of negative tests. We get the reports of the positive tests. So the positives go into the numerator, the top part of the percentage. They don't necessarily go into the bottom. So as we have more and more people that are using the rapid test, we've had some major employers in the county that have utilized rapid tests amongst their staff. Same thing. The positives count towards our number. The negatives do not. Now, that's some context for interpreting this. There's still a real increase in the percent positivity, absolutely. But it's going to become harder and harder to understand what that trend is doing over time because of how the data is collected and reported or not reported to public health. So as we've been saying all along, there's really no one piece of information that we can really rest on our laurels and say, this is the descriptor of what's going on in the pandemic. We really have to take all of these things into account. So understanding that about percent positivity is important. This is a new look at the age distribution of cases. So each bar represents 100% of all of the cases by week. And sort of the way it gets tracked is by MMWR week. It's basically the numbered weeks throughout the year. So here we're back in mid to late March, and then week 44 is the most current week we have available. So this shows the distribution of ages within all of the cases from that particular week. So in our most recently available week, we had around 8% of our cases were in the 0 to 18 years category in the blue. Then we had an additional taking us up to 41%. So an additional maybe 36% that were these 19 to 49-year-olds. Then we had about 8-9% that were 50 to 59-year-olds, another about 10% that were 60 to 69-year-olds, and then we had 40% of our cases that were 70 plus. This week is the first that we've seen such a surge, or I don't know if surge is quite the right word, but that we've seen such an increase in the proportion of our 70 plus year old individuals representing that many cases. You can see that as we got into the summer, the age distribution, the older adults were representing fewer and fewer cases, and then it's been a little bit more. We do have a couple of skilled nursing facilities that are experiencing outbreaks right now, and so we are seeing some more cases amongst that population, which could be driving this. You can also see there's just been some variation as when we're getting those pediatric patients, and sometimes the middle adults here are really expanding more, but this is that age distribution of cases to date. Now we've got, I'm showing you here the death trend, and this is showing the number of deaths by day, and our trend for the most part, I would say it's starting to change, but it's not significantly different just yet. And this could be due to a time lag. As you know, when we see an increase in cases, it usually takes a little bit of time before we see that increase in hospitalizations. And then from the time we see hospitalizations increase, it takes a little bit of time before we see the deaths increase, just due to the nature of the disease process and how long it takes for people to go through some of those processes. We are starting to see a few more deaths. At this point, it's a little bit difficult to attribute whether that's based on community spread and the increased incidence, or whether it's due to the skilled nursing facilities. We do know that we are seeing a few deaths from these skilled nursing facilities that are currently experiencing outbreaks. Time will tell if the community transmission is going to be contributing to that as well. You'll note, and I want to pause here to note that we don't have information about hospitalizations here right now in this presentation, and that information is not on our data dashboard either. We're having some coding, or the historical information is not on our data dashboard. A daily number is, but we had some issues with some coding from Lakeland. They had things they were pulling out of their dashboard and automating to some files that we had that were then behind our data dashboard. So lots of detail in how that happened, but there were some moment, a few week period where the numbers were coming over incorrectly and actually overstating the number of people in the hospital. What we do know is we have seen a real increase in the number of people in the hospital. And this week, the 7-day rolling average for number of patients in the hospital who are COVID positive has been in the high 20s to low 30s. And that is the highest number, highest rate in number of patients that we have had in the hospital with that diagnosis throughout the pandemic. So the hospital is definitely working through, and they continue to have capacity, they continue to have PPE and those things, but this is something we really need to keep an eye on. Testing, percent positivity, all of those things can really be subject to test availability and a testing strategy. So those numbers can kind of shift depending on what's going on. The hospitalizations is really one of those key factors that it can't be easily influenced by external factors trying to enhance or hide any sort of story. I mean, that's kind of, if there's enough people becoming sick that they need hospital level care, they're going to show up. So the fact that we're seeing some real increases there is definitely something we're paying close attention to. It does not seem to have increased as sharply as the number of confirmed cases. And that does make some sense with the age breakdown I showed you, with some younger adults are representing the bulk of the cases. But when we have some skilled nursing facilities that are experiencing some positive cases, that we know that can flip a little bit. So that's with hospitalizations. This is a different graph, but to characterize some of the deaths. So this is a box and whisker plot, and I don't know how many of you are very familiar with these, But from this line to the edge of the box is the top quartile. So those are the 25% oldest ages amongst people who've died. And then from the edge of the box to the middle is the median, which is about 82 years of age. And you can't really see the median line here very well. So then half of all of the deaths that happened are in that box. And then this represents the youngest quartile of ages. So this gives you a little bit of an idea of what that age range is and how the ages are distributed within there. So with a median age of 82, we're definitely seeing a lot of our deaths are happening almost exclusively amongst older adults. We do have some distribution here in the low 70s down to the high 50s. We do have 2 outlier deaths that happened in the spring. These are not new, but they did happen in the spring of individuals in their 40s that had significant comorbidities that had passed away due to COVID. But just to give you an idea, here in Berrien County, we're not seeing any shifts in our age trends. And if we actually look at the deaths that have happened in the last 2 months, most recently, that is actually a higher median age than our population in total. So the who is dying has not really changed. That trend is remaining static. And then the last piece of information, I apologize that we don't have this very well visualized here, but I know there's been a lot of questions about geographical distribution. And generally the geographical distribution of cases follows somewhat with our population centers. So in our more populous communities, we have more cases, and in our less population or more rural and less densely populated areas, we have fewer. One exception to that would be Benton Harbor does have a lot more cases, and this is cumulative through the whole pandemic. Benton Harbor and Niles are about on par, and we know that Niles population is a little bit larger. These are based on zip codes, not just city boundaries. That's the way that we're able to get the data. But this does, again, speak to the fact we know that there's been a disproportionate impact that was exacerbated and heightened more in the spring and early summer months, but it does continue a bit with African Americans being disproportionately impacted by COVID-19. But we do have this information on our dashboard, but the scale on the map does make it hard to see some of the nuances between communities. We've been working to get that updated. Hopefully that will be revised soon. And then the last piece of information I just want to show you is about schools. And we do have 76 cases as of a couple of days ago. I'm sure it has increased by a couple in the last few days, but 76 cases, 49 amongst students, 27 amongst staff members. And we do know in the majority of these cases, almost all of them, it was not due to school exposure. It was due to a community or household exposure. And, or we surmise there is not evidence that it was in school. When we look at quarantines, this is where we know that the vast majority of those were due to community exposures. There have been definitely some school exposures that have led to quarantines. So 818 individuals had been quarantined that were affiliated with schools, 731 students, 77 staff. Again, the biggest driver of quarantines amongst student and staff is community exposure or household contacts that are positive. So I'm going to stop there. I'd be happy to take any questions about the data, and then we can move into a little bit more discussion.
I have a question about the Niles haunted house, especially because of the incidents of COVID there. And at what point do you decide that this isn't a safe thing for the community to do? And that's also to apply to schools as well.
Right. So there's a lot of different factors that we have to look at in terms of, is this a quote safe activity and should it continue, or do we need to intervene? So one, we do have the epidemic orders, and they were actually updated yesterday and made slightly more stringent on gatherings. But those orders are in place, they're in effect, they are pertinent and relevant to Berrien County, and we need to be following them diligently here in Berrien County if we want to try to bend that curve again and try to flatten out our number of cases. So what we look at with gatherings, one, are they in compliance with the orders in place? And then two, you've got to look at, do they really seem to be contributing to spread? What are some of the control measures in place? What is happening to make sure that if that activity is done, it's done with the least risk of transmission possible? There are many things that at face value might seem like, oh, should we be doing that? But when you really dig into how is the operation being done, what's happening, rigid health and safety measures and really strict compliance to them really can mitigate risk in many of these situations. Because on the flip side of things, we can't go back to where we have no activities and we're not doing anything. We have a whole other health issue with the economy being shut down and all sorts of things. So there's definitely that balance there. And I know you're not suggesting a strict stay home order. The other thing that we take into account is the cost benefit for health without thinking of COVID risk exclusively. So going to schools, we've been getting that question quite a bit. What we're seeing in those numbers I shared with you, that's 76 cases amongst approximately 20,000 people in Berrien County. So that amount of cases over a 2-month time period that schools have been open, over that portion of the population, we would expect those numbers to be higher if they match just the background rate of what was going on in the community. It actually appears to be lower than what's going on in the community. And I attribute that to the schools being really diligent in their health and safety practices. We know the students and the staff are masked. We know that social distance is being observed to the extent possible. The number of contacts that people are having with one another are minimal, as minimal as they can be. We know that there's lots of symptom screening. If anybody is ill, they're being excluded. There's good hand hygiene. There's some cleaning protocols in place. All of those things really make it so that we can continue to do in-person education and we're not seeing the really widespread transmission. Now, some of that might also be due to the nature of children. We know that research is showing and continues to reiterate that children are less likely to spread COVID when they're infectious and they're less likely to be infected. So children and schools really do not appear to be driving this. And that's not just based on our Berrien County experience. There is a lot of peer-reviewed research that is emerging that is showing that schools are not driving this in communities. So the other side of this, we know that the mental health burden is increasing amongst our adolescents. We have pediatricians reporting that they're seeing very high percentages of their patients with, quote, dark thoughts and dealing with depression. So when we take a holistic view of what our children and our communities need, taking COVID-19 risk into account, but also some of the many other issues, that brings you to a different cost benefit analysis than if we were looking at COVID exclusively. Now, that doesn't mean we're ever going to be in a situation where we're just saying keeping schools open at all costs, regardless of what's going on. But that risk benefit is always going to continue to be recalculated based on what's going on in the community.
I think you're doing a phenomenal job, a great job, especially with the contact tracing and everything. It's just really great. My daughter is in St. Joe schools, and hey, I couldn't be happier. So one other question. The new orders on how many people, I've read them, but could you just go over that with me a little bit? How many people can be in one gathering at a time?
I might have to defer to Courtney for a little bit of help here. There are different limits depending on different scenarios. I'm pulling up the order right now. It depends on whether it's residential versus non-residential, and if there's fixed seating like in an auditorium or a stadium where there's a set number of seats, or if it's just an open air space.
Well, that's okay. I can look it up. That's okay. I can look it up.
Yeah. Thanks, Jillian, for sharing this. So there is this, the MDHHS is putting out some of these quick guides for the epidemic order, but when you're indoors, you do need to have only 10 persons or fewer if you're in a home, or 50 or fewer in a non-residential venue without fixed seating. And there you're at 20% or 20 people per 1,000 square feet. And outdoors at a home, you can have 100 people. I think that's still too many, but we're getting to the point too where weather is prohibiting outdoor gatherings that large to some extent. And then without fixed seating, no more than 50 people can gather, and it needs to be at this density. And there are some changes with restaurants too. So we'll share these infographics with the board. I believe they are on social media and our website as well, but we'll share them with you.
Thank you.
Thank you. So I saw Linda's hand and Bill's hand.
Mine too, Peg.
Sorry, Ray.
That's
Okay, let's go Linda, Bill,
And Sam.
Ray. Okay, Linda?
We are seeing an increased request for home delivered meals from seniors in the past week, which is not surprising given the death statistics. I've also noticed that of the people who have gotten COVID-19, 3 out of the 5 have school-age children. Now, these are older school-age children, and two of the 3 people were asymptomatic when they tested positive. They have not been able to trace where they came from. It's very clear it's not from here. So I'm a little cautious about, being so optimistic about the absence of transmission by children, just because of my experience with the people here.
So one thing I guess I'd like to say is, so we never said absence of transmission. It is
I know.
risk, so it's lower.
I'm not trying to be disparaging. I'm just observing data that I have seen up close and personal. It's not broad. I mean, it's very small. It's a small group of 5 people. So I understand it's not public health, but that has just been my observation. And for what it's worth, it may not be worth anything, but it's just interesting to see, because I've been watching how this has morphed. And we, until the end of September, we had no staff cases whatsoever. So it's just interesting.
Oh, yeah. So we need to stick with the actual data set, but and we have just 6 minutes. So Bill, do you have a question?
Yes, thank you, Peg. Nikki, going back to the deaths, maybe that's the most morbid place to get a number. Can you call out the number of seniors who have died from this and separate nursing homes, extended care, group living experiences versus individual exposures that have occurred as the last month or so has gone on?
Yes, we are able to do that. I don't have that right now, but yes, that is absolutely possible.
Okay, that would be interesting for me. Thank you.
Okay.
And Nikki has said that we can go beyond 8:30, but we want to be respectful of staff time. So Ray, you had a question, and Joe,
Yes,
you're off mute. So
Thank
let's
you.
do Ray.
I'm off mute. Yes. Thanks, Peg. Nikki, why are with the rapid test, why are the negatives not being reported? To me, that is a real discrepancy skewing our numbers.
Yeah, so that's a good question. And I mean, this sort of evolution is something to, I guess, kind of be expected as we move throughout this outbreak. So there's a couple of factors. So one, when rapid tests are happening, for the most part, the results may not be hitting an electronic medical record. So most laboratories or providers that it's usually laboratories that report these sorts of test results into the state system. It happens electronically through HL7, all of these things. That's very technical. But usually it's through an electronic medical record. So if you go into a clinic, and some of the tests are happening now where there's not even a lab analyzer. There's a little card that they put your specimen on, and then a trained individual, but doesn't even have to be a medical professional, reads and interprets that rapid antigen test. And then you get a piece of paper that says you're positive or you're negative or something like that. If it doesn't actually hit any type of medical record, or we have some employers that are using these tests, they don't have an electronic medical record. They have no mechanism for reporting into existing disease surveillance systems. So that doesn't happen. They know they have to report the positives. Technically, they need to report the negatives too, but they know that reporting the positives is a really big deal. And we do have a lot of our own residents that might get a positive test result from somewhere, suspect it won't be reported to their local health department, us, and then they call us and say, hey, I got this positive from Indiana. So there are mechanisms in place for tests from Indiana to be reported to us. There can be up to a 4 or 5 day lag in that, and the rapids fall prey to the same thing where they're never going to get reported up through the state of Indiana to then get reported to Michigan to come back down to us. So this is a side effect of really scaling up testing and using testing technology very quickly. Our reporting technology just doesn't scale and adapt as quickly.
Why are people going to Indiana? Just proximity and Niles area, or?
There's a lot of folks in the southern part of the county that are being tested in Indiana. A lot of people either work there or that's where they already seek healthcare. The rapid tests are more abundant in northern Indiana than they are in Berrien County, although that's starting to shift as we're having more rapids available here. But there are people who, if they want to know that day, they go to Indiana to get a rapid test because
makes sense.
They can do that.
They can do it. Okay, thank you.
You're welcome.
Joe, did you have a question? I see you're not muted.
No, I had trouble getting on in the first place, so I'm just trying to keep my mouth shut and listen.
Okay. Thanks. So I want to make sure before Linda, you speak again, that we make sure that everybody has a chance to speak. So Dr. Edwards or Dr. McBride, is there anything? Okay, Dr. McBride.
You know, and this may be too far in the future, but are we ready do you have any sense of vaccine availability, distribution plans, how we're working with pharmacies, hospitals, et cetera?
Yeah, that's a great question. We actually had a fairly lengthy in-depth call with the state yesterday about information they're getting from the CDC about this. So there are 2 companies with vaccines that seem like they will be approved first. There will be the vaccine from Pfizer is expected to be approved first. And if everything goes according to plan, that could still happen yet this year in December. And the Pfizer vaccine is the one that requires ultra cold storage. It needs to be stored at -70 degrees centigrade.
Whoa,
So, yeah.
Wow.
Ultra cold storage. So
that goes to absolute zero. Wow.
Right.
So
So
now
there,
we'll have a shortage of liquid nitrogen.
dry ice actually, but yes.
Yeah.
So there's a lot of logistical issues around distributing that vaccine, as you can imagine. So we're working through a lot of those. We do expect in the way that ACIP, which is the American, I don't remember the C, but the American Committee on Immunization Practices. I read Jillian's lips there. But that's the group that comes up with vaccine recommendations across the board. They have come up with recommendations in some priority areas or priority groups and orders in which we would do those. It has consistently been that healthcare providers will be among that first group, priority group. So healthcare systems often do have some storage capacity, not all of them, but larger healthcare systems and hospitals are more likely to have some of those ultra cold freezers because they are used in some laboratory things. But so there's plans for how does initial distribution go through healthcare systems, how do health departments coordinate with that? Then the next vaccine that's expected to hit the market would be the Moderna vaccine. That doesn't have the same sort of storage. It doesn't require the same temperatures. It still has certain storage and handling issues that we need to work through. But so all of that to be said is we're working very closely with our state partners. The state and the federal partners are really working on contracts with pharmacies. So, I mean, this is going to be an all hands on deck. The vaccine is going to come through a wide variety of different providers. The tracking for it is going to be very intense, as even just with those 2 vaccines, they have different timeframes in which you have to wait between your first and your second dose. They both require 2 doses. So there's a lot of that. We have our plans. We've been working through and brushing up on our plans for quite some time. We have started to acquire materials that will allow us to more comfortably and efficiently do drive-through vaccination, because this isn't just plug and play with other types of vaccine where everybody gathers in a large gym and you just line everybody up and do that. We're not going to have crowds like that indoors. So we do have some drive-through tents that we actually used for the first time yesterday at a community flu clinic. So we're working to get all of the logistics of how that works down. There will be some issues, especially with that first vaccine, of once you get the vaccine, you're going to have a set number of days that it needs to be from the time you receive it to the time it needs to be in people. And so we're really working with partners and starting to really think even more broadly about partners as to how could we, if we needed to line up 300-400 people in a 5-day period of time to give them vaccination, what does that look like? Where do we go? How do we move through? And how does that line up with the priority areas as we've been given them? So
I'm impressed, Nikki. You've thought about this. Thank you. I thought the military was going to give it a shot. Never mind.
All right. Linda, you had a follow-up question? You're on mute. If you'll unmute. There you go.
I've forgotten it, so
Sorry
never
about
mind.
that.
Never mind.
All right.
Peg, this is a real quick question for Nikki, if you don't mind. Hey, Nikki, I just saw an article pop up on a new strain of the coronavirus that apparently has originated in Spain. Are we seeing and going through Europe? Is that part of our concerns now?
I'm not sure. I'm not familiar with what you're doing, what you're reading. I am not. Yeah, thank you. I'm not familiar with a lot of that. I know there has been some consistent examination of the virus to see if mutations are happening, and if they are happening, what is the impact of that? If this were to mutate to be more virulent and cause more severe illness, that would clearly be a change in things, but it may just be different. So we'll take a look at that. But no, we're not hearing that that's necessarily related to what's happening in the increase in cases that's happening in the United States and in Berrien County right now. What I think is more likely to be attributed to some of the new cases across the country. Not every city was hit universally. So there are some cities that really didn't have as high of highs in the spring. And so they had more non-immune people. So it's kind of going through those communities right now. But also we're starting to just move to more time indoors and larger sizes of gatherings. And we're hitting a bit of this pandemic fatigue. It's that 7-month slump that everybody just wants this to be done. And I totally empathize and relate. But I think that probably one of our bigger drivers is that we're having more gatherings. People are having more contact with one another, and we're just growing tired of the vigilance with those protective measures. So I think one of the best things that we can do, and I know you didn't ask this specifically, Ray, but I think one of the best things that we need here in Berrien County is people to really avoid large gatherings, small gatherings. If you're going to gather, reduce contacts with other people, particularly indoors, wear a mask, wash your hands, watch your distance with other people, and really just be vigilant about those things. Stay home if you're sick. You can't have symptomatic people out and about spreading things.
And get a flu shot.
And get a flu shot, absolutely. And Courtney does have a picture from our community flu clinic yesterday, so she'll show you that just to give you an idea of what that looks like. While she's sharing that, just from in the month of October, we've done 4 flu shots Saturday or 4 flu shot Fridays. We've done 1 community clinic thus far. We've given 284 flu vaccines this month. So without having a whole lot of extra events and doing things in our office, I mean, I think we're well on our way. That is more flu vaccines than we've done in the month of October than typical. So these are our drive-up tents. So you can see that there's a space for a car to drive through, but there's also a covered area where staff are able to be, so that we can use these in colder months to really have our staff be protected from the elements and be outside longer for these types of clinics. And there's electricity in the tents, so there's lights and heaters and those sorts of things to really make it valuable. The way I don't know, Courtney, if you want to say anything else about the flu clinics.
No, we had our first one this past week, so it was kind of our test run. And I think things went well, and we learned a few things too, so we'll keep improving on it. But yeah, it was really nice to have them. It's easy to take and go to new locations, so we'll have them set up in Niles on the 7th.
Yeah.
And where was this clinic held at?
This clinic was at the Benton Harbor Charter Academy.
Okay, thank you.
So I'd like to pick up a couple themes that the Board of Health has been sharing, and that is the extraordinary work of the Board of Health at your direction, not the Board of Health, the Berrien County Health Department. So I just wanted to say thank you to everyone and just pass on our thanks to the staff. We were amazed and so appreciative of what's been done. The dashboard, the flu clinics, the figuring out the vaccines, the keeping all the other plates spinning at the same time. Looks like good hires on tracking, on contact tracking, and just it's humbling to know you and to have everything that you're doing. So thank you, and keep within budget too. And speak to the public knowledgeably with a clear message without going off task. So just really appreciate the Berrien County Health Department. So thank you for the excellence.
Yes.
Thank you.
Yes.
Here.
All
I
right.
definitely appreciate your support.
If there's nothing else, we stand adjourned. Thank you for this special meeting. I know you have a lot going on, so.